Welcome to our continuing series of virtual voices. And thank you for your letters and your comments. We very much appreciate receiving them and responding to them. Today, we have very eminent and illustrious pediatrician, Dr. Ruth Etzel and Dr. Sophie Balk, whom I known for a very long time. And of course, our moderator is our member of our board of directors, Apurv Gupta. Apurv, over to you.
Thank you so much, Dr. Durbach, and welcome to everyone joining from around the globe, another series of World Information Transfer's Virtual Voices series. If you joined us last time, we had the alumni takeover. Today, I'm pleased to welcome Dr. Ruth Etzel and Dr. Sophie Balk. Dr. Ruth Etzel is an internationally recognized pediatrician, environmental epidemiologist, and preventative medicine specialist. She performed the first study to document that children with secondhand exposure to tobacco smoke had measurable exposure to nicotine. Her pioneering work led to the nationwide effort to reduce indoor exposure to tobacco, including the ban on smoking in US airlines. From 2009 to 2012, she led the World Health Organization's activities to protect children from environmental hazards. Dr. Sophie is an attending pediatrician at the Children's Hospital at Montefiore and professor of pediatrics at the Albert Einstein College of Medicine in Bronx, New York. Her academic work focuses on pediatric environmental health and integrating environmental health issues into pediatric practice. She is a former chairperson of the American Academy of Pediatrics Council on Environmental Health and currently is a member of its executive committee. Thank you so much, Dr. Ruth Etzel and Dr. Sophie Balk, for joining us for a session of World Information Transfer's Virtual Voices series. We're very excited to hear what you have to share with us, especially the environmental factors relating to children's health. Over to you, Dr. Etzel.
First of all, thank you so much for the invitation to be here. Dr. Balk and I are tickled to spread the word about a new book that just came out from the American Academy of Pediatrics. It's called Protecting Your Child's Health, and it was just published last month in October. And what this is a book that talks about the kinds of questions parents may have about the environment, and it gives the answers that may help them to better care for their children. And it's all about prevention. And when we think about prevention, I always think about Stephen Covey. Many of you probably remember him. He wrote that very popular book, 7 Habits of Highly Effective People. And for those of you who haven't seen his book, he has a very famous quadrant where he talks about how people spend our time. And looking at people like Sophie and I, people who are pediatricians, let's give you an example of how he thinks we spend our time. First of all, we spend a lot of time on things that are urgent and important. And for pediatricians, that might be things like treating meningococcal meningitis.
Okay.
I was just beginning to talk about the book that Stephen Covey wrote, The 7 Habits of Highly Effective People. And if I can move the slide forward again, there are some things that Covey says are urgent and important, such as meningococcal meningitis. Next slide. These are the 4 quadrants. And what Mr. Covey says is that all of us should try to spend more time in the right upper quadrant, which is the quadrant of things that are not urgent, but important. And that's where environmental health concerns often land. They seem to be things that we can put off till tomorrow. And because of that, they don't seem urgent. And so sometimes we actually don't take action on them because we're all busy dealing with things that appear to be more urgent. But part of what this book does is to bring to parents' attention the small things that they can do every day in order to put prevention into place. Next slide, please. So this slide shows children and child health, but it also shows on the left the underlying factors that lead to much disease. Next slide, please. So most of the healthcare that we do is up here between the child and child health. That is taking care of the common things that children have that bring them to the emergency room or the clinic. Broken arms and pneumonias and other ear infections and things. Next slide, please. But we also recognize to get to some of these underlying causes of disease, we need to spend more time in advocacy. And that's advocacy not just by doctors about child health, but by everybody, parents, grandparents, brothers, sisters, to try to better prevent the underlying factors that cause disease. Next slide, please. So one of the things our book talks about is the fact that children are more than just little adults. They're short, they're closer to the ground, and so any pollutant in the air that's heavier than air is going to be breathed a lot more by children because they're breathing closer to the ground. They also have increased food intake and metabolic rate pound per pound than do adults. They have different excretion of chemicals than adults, and they have a long shelf life, if you will, the time between the time that they are first exposed to a chemical and the time that its effects become apparent. So for example, for a chemical that might cause cancer, children have a good 20, 30 years before they may exhibit any symptoms of that cancer. They also do an awful lot of hand-to-mouth activity, putting everything that they find into their mouths because that's how they discover what the world is like when they're just very young. And they take in more air pound per pound than adults. They have an increased skin surface area than adults. And they have ongoing development of many of their organs, especially their brain and nervous system. And so chemicals that affect the nervous system that children are exposed to very young may permanently impair the growth of their nervous system. Next slide, please. We also recognize that children living in high-income countries have very different environmental exposures than children living in low-income countries. For example, in a high-income country like the United States, many of us are concerned about lead in tap water, especially if we're feeding it to young infants less than a year of age in their bottles with reconstituted formula. Or we might be concerned about pesticide residues in many of the foods that we feed children, or mercury in their sneakers. But in low-income countries, parents may be concerned because there's no tap for running water. Or they might be concerned that children are drinking pesticides from reused Coca-Cola bottles, and that can easily cause child death. Or they might be concerned about children's exposure to mercury from small-scale gold mining. So the kind of things that parents are most concerned about will vary depending on where they live. Next slide, please. The WHO did a study not too long ago saying that about a third of all disease among children could be prevented by modifying the environment. But it turns out that even though we have speed limits to protect children, this one comes from Nairobi, where it says warthogs and children have right of way. Next slide, please. But really, they are not always protected. This slide shows for a typical country the different kinds of provisions that may exist to try to prevent children's exposures to contaminants in food, contaminants in cosmetics, contaminants in indoor air, water. But you can see that these pieces do not fit together perfectly. And so there are many times when children fall through the cracks and become exposed, even though there might be legislation on the books that's designed to prevent those exposures. Next slide, please. One of the problems in the United States is that we spend a very modest share of our resources on prevention. I worked at the World Health Organization a while back, and this slide was developed for all countries to show that only a tiny share of resources in all countries are allocated to prevention today. You can see that of the total US $5.3 trillion that the world spends on health expenditures, the vast majority, more than 96%, is spent on treatment and overhead, even though we know that the environment may cause at least a third of these diseases, And we know that tobacco, alcohol, unsafe sex, and other preventable causes are responsible for many more. So there's a strong argument for increasing our attention on prevention. Next slide, please. One of the things that we know is that the health improvements that have occurred in the United States really have occurred not so much because of treatment, but really because of 20th century advances, or because of advances in sanitation and advances in housing and advances in food and beverage safety, and not because we've done tremendous advances in medical care. Next slide, please. And so this book really is about the bottom of this triangle, which is primary prevention. And primary prevention is looking at population-wide, proactive, upstream preventive actions. These are things like eliminating indoor smoke, or eliminating lead in petrol and paint, or providing safe drinking water. The primary prevention means that the unhealthy condition never has a chance to occur. Next slide, please. But it takes a long time to put prevention into place. You know, for many years, smoking, for example, was considered very glamorous. It was back in 1950 that the first epidemiologic studies were demonstrating that smoking was the main cause of the most common cancers. It wasn't until the late 60s that smokers became associated with villains. And finally, in '69, cigarette advertising on television and radio was banned in the United States. But it took 60 years until the World Health Organization put primary prevention into place. And that was in 2003, when 192 member states of WHO unanimously adopted the Framework Convention on Tobacco Control. And then finally, in 2010, the Motion Picture Association of America included smoking as a factor in rating movies. So you can see that it's a long struggle to try to put prevention into place, even for something as well known and understood as smoking. Next slide, please. But when we do, it makes a big difference. We know that all of us can advocate, for example, for 100% smoke-free places. And those of us in the pediatric clinic are also encouraging families to take voluntary steps to make their homes 100% smoke-free. Some countries have gone so far as to prohibit smoking in cars. Australia and Bahrain and Canada and Cyprus and Mauritius and South Africa and the UAE have taken this step. Next slide, please. And the effect is dramatic. This slide shows what happened in Scotland following the clean indoor air legislations. They found that those clean indoor air laws resulted in reduction in low birth weight, reduction in preterm birth, reduction in intrauterine growth retardation, and reduction in hospital admissions for childhood asthma. So there was a lot of bang for the buck. Next slide, please. In the United States, we know that about 33% of adult subsidized housing residents were smokers in 2009, compared to about 20% of adults not living in a subsidized housing. And we estimate that about 521 million could be saved each year by prohibiting smoking. 341 million in smoking-related health costs, 108 million in renovation expenses, and 72 million in smoking attributable fire costs. Next slide, please. Another prevention intervention that is being tried now is prevention of pollution from indoor cooking. In 2010, the Global Alliance for Clean Cook Stoves was formed, and their goal was to have 100 million homes adopt clean and efficient stoves by this year. And the importance of this is that those clean cook stoves cut the smoke and the carbon dioxide emissions by 80%. Next slide, please. So there are other prevention efforts that have also had important impacts. For example, the World Health Organization has been a leader in pointing out the importance of preventing exposures to children from persistent organic pollution. Next slide, please. The WHO has also pointed out that endocrine disruptors from persistent organic pollution can cause congenital disorders, including cryptorchidism, hypospadias, and some thyroid hormone-related problems. Next slide, please. And WHO has pointed out the importance of countries bringing the endocrine disrupting chemicals to the attention of parents so that they can reduce their children's exposure. Next slide, please. And when countries take steps to reduce these persistent pollutants, we see dramatic effects. The top two graphs show dieldrin and DDT in breast milk in Sweden. And you can see a dramatic reduction after Sweden took steps to remove these persistent organic pollutants. But the bottom slide shows that there are constantly more persistent organic pollutants being introduced. And so even while dieldrin and DDT were decreasing, you can see that PBDE was increasing in breast milk in Sweden during the same time. So we have to watch out for new introductions of persistent chemicals, even while we are phasing out the old ones. Next slide, please. Lead poisoning is one of the more important pollutants because it could be responsible for as much as 15 or 20% of mental retardation. And hundreds of millions of children and pregnant women are exposed to different sources of lead. Next slide, please. Many of you have probably seen this graphic, which shows the societal impact of a 5-point loss in population mean IQ score. You can see that with an average IQ of 100, the normal distribution in the United States would have about 6 million children being considered disabled or mentally retarded, and about 6 million being considered as gifted. But if we have a shift in the average IQ, it will increase by 57% the number of children who are mentally disabled, and a corresponding decrease in the number of children who are gifted. Next slide, please. And we still see many sources of lead in homes, including lead from chipping and deteriorating lead paint. Next slide, please. Lead is important not only during infancy, but it continues to be important throughout the life cycle of a child. During infancy, the largest exposure comes from water if it is mixed with formula to feed the infant. During toddlerhood, lead comes from lead paint chips and from soil and dust. During adulthood, it comes from occupational exposures. And
Dr. Ruth, I'm just going to take 1 minute to remind the audience that the floor is open for questions. And if you do have a question, please post it in the small little messaging box that you might see at the bottom of your screen. Or if you're online from an iPad, then it would be the top 3 buttons on the side. If you click those, you can chat and post your questions. Thank you very much. Dr. Etzel, you may continue.
thank you. And then finally, adults who become pregnant can give that exposure from the bone to the infant through the placenta. Next slide, please. And that results in lifelong effects for children. You might see aggressive behavior, inattentive behavior, misbehavior of all kinds, and trouble learning. Next slide, please. Or as teenagers, children with higher lead levels are often skipping school, becoming pregnant, or smoking. Next slide, please. And as adults, lead poisoning can result in memory loss, high blood pressure, and heart attack. Next slide, please. So we've been working for over 100 years to try to get rid of lead. And partially it's a success story because unleaded gasoline is almost gone. But the saga continues because now we're seeing more and more countries introduce lead into paint. Next slide, please. So at the end of the 20th century, most developed countries had phased out leaded gasoline, but very few developing countries had done so. And so the United Nations set concrete targets for completing elimination of lead in gasoline. Next slide, please. And they began a campaign with a small staff in Nairobi in 2002, and they enlisted 120 or more members who were scientists and doctors and government professionals and industries and international organizations. Next slide, please. Next slide, please. And together they did a lead petrol phase out campaign. And this shows how it started in 2002. And take a look at the countries that are dark blue. Those are the countries that have already eliminated lead from gasoline. But when you look at Africa, for example, you can see that there's still, in 2002, an awful lot of leaded gasoline in use. Let's move to the next slide. By 2005, you can see Africa is starting to turn darker blue with more countries removing lead from their petrol. Next slide, please. By 2006, almost all of Southern Africa has turned blue with those countries removing lead from their petrol. Next slide. Here's 2008. You can see around the world, almost all countries have taken lead out of their petrol. Next slide, please. In 2010, we're down to just a few leaded countries: Afghanistan, Myanmar, and North Korea, and a few countries, 6 of them, with dual use of leaded and unleaded gasoline. Next slide, please. In 2011, we were down to just 3 countries with dual use: Algeria, Yemen, and Iraq. Next slide, please. And our most recent data show that all but 2 countries have now removed lead from gasoline. And those 2 countries are Algeria and Iraq. So you can see the difference between 2002 on the left side of your slide and 2015 on the right side of your slide. A terrific success for advocacy by parents and governments to remove lead from gasoline. Next slide, please. And as the lead came out of the gasoline, children's lead levels in their blood fell dramatically, much more than any of the models had predicted. And so this gave us a new understanding that it actually had accounted for a fair amount of childhood lead poisoning. Next slide, please. And this is true in many countries around the world. This slide shows 14 different countries, from Cape Town, South Africa, to Christchurch, New Zealand, and all of those countries showed a dramatic fall in children's blood lead levels when they took the lead out of their gasoline. Next slide, please. So what about paint? I talked about this as kind of an unfinished agenda. Next slide, please. It's unfinished because over 100 years ago, many of the European countries banned any lead in paint. France did it as early as 1909. And Belgium and Poland and Spain were doing it in the 1920s and the early 1930s. Even Cuba did it in 1934. The United States was a relative latecomer to this party. It didn't remove lead from paint until 1978. Next slide, please. But as those countries phased lead out of paint, the paint industry was looking for profits elsewhere. And so the US paint industry looked to India and China and other parts of the Asia-Pacific region because they thought that might help them to grow the paint consumption in those parts of the world. And so children today are still being exposed to lead paint in many countries because even though some of them have regulation, there's very little surveillance or testing. And there's often a lack of capacity to test for lead, even if the parents want it. Next slide, please. So the UN again brought together a partnership to eliminate lead in paint, and this one was launched in 2010, mainly to raise awareness among customers and to promote certification of paint products to help consumers to recognize the paints and coatings that have no lead. Next slide, please. And that has been quite successful. And what it shows is that our personal choices matter, but we also need government to help us with labeling in order to make those personal choices more educated. And one of the areas where our personal choices matter quite a bit is climate change. And we encourage through this book parents to take actions with their children in order to calculate their carbon footprint, reduce it by not using carbon, not using as much carbon. For example, if you usually use your dryer to dry your clothes, consider putting them on the line instead, and tell the stories to your children and to your friends so that they can consider calculating and reducing their carbon footprint as well. We also know that the kind of practice that a doctor has matters. Doctors can green their homes and their workplaces and educate the parents in their practice about what they've done and how easy it is to make green changes in their home. And then the political choices also matter. We need to make changes locally, but we should participate fully in the political process so that our legislators are also empowered to make choices for the society. Next slide, please. And, you know, in medicine, these are considered to be win-win choices. If you burn calories instead of carbon, that means that you're partaking in more active transport. And that has the result of cleaning the air and also fighting obesity, because muscle power is carbon neutral on the right diet. When we recommend social time instead of screen time, that means more interactive family and group time. And this combats isolation and depression. And so that's a win-win. When we eat lower on the food chain, it supports local farms and the local economy. And it also improves nutritional quality and hopefully lowers our risk of chronic diseases. So that's a win-win. And any energy efficiency steps that we take save money and, well, actually supports health. So that's a win-win. Next slide, please. So as we take these steps and look for these win-win choices, we need to ask our policymakers to replace biomass with clean, renewable energy and to develop smart local grids, because this reduces emissions and prevents new emissions and also results in less cardiopulmonary disease and death and gets necessary energy to households. We need to ask our politicians to improve public transport and create bike lanes, because that reduces the need for having a personal vehicle, decreases congestion and noise and air pollution, and promotes active transport. We need to ask our politicians to promote solar hot water and water conservation, because that reduces air pollution, promotes health, and saves money. All win-win choices. And finally, strengthen the traditional diet by continuing to eat food that comes low on the food chain, will support the local farms and the local economy and prevent obesity and lower the risk of chronic diseases. So there are lots of win-wins that we can advocate for and that we can ask our elected politicians to advocate for. Next slide, please. So overall, environmental health, though it doesn't receive the attention that we wish it did, because it's an invisible issue, is gradually becoming more visible. Next slide, please. And primary prevention of environmental hazards delivers great value for money. We can compare it to immunizations. For every $1 spent on immunizations, $10 to $27 comes back to us in good health. For every dollar spent on lead paint hazard control, $17 to $220 comes back to us in good health. And you can see these are much higher than things like investment in bike pedestrian trails or investment in chronic disease. Next slide, please. So finally, the big message of our book is, let's invest more in primary prevention. by asking parents to take steps in their homes to reduce children's exposures, but also by asking our politicians to get involved in effective interventions at the national and international level to eliminate smoke, so that smoke and tobacco and lead in paint and all the other pollutants are eliminated from the environment before they have a chance to harm children. Next slide, please. Because an unacceptable number of kids are harmed or die unnecessarily from environmentally related diseases. And these exposures are largely preventable. We know that preventive interventions are effective in protecting children, and we need to garner the political commitment and resources to reduce these preventable deaths and illnesses among children. Next slide, please. One more slide, please. We are happy to take your questions about the new book that we published for parents, and we'd like to open the audience to hear what kinds of questions you have about the role of prevention in protecting your child's health. Thank you.
Ruth, it was absolutely brilliant. Of course, you usually only do things that are brilliant. So it's just, but I have a couple of questions. Number one, are all the slides that you presented, are they from the book?
No, our book, our book is primarily focused on the American audience. And so the things that we're talking about here are global, because we realized that your interns are coming from all around the world. And so those slides are not all in the book. The book is focused on problems that the US children have. Someday we might do a book for parents around the world, but this first one is for American parents.
Well, I hope that you do that, but I just wanted to mention that I was we were one of the people that joined IPAN. You know what IPAN is, right?
Yes.
And what I'm going to do, I'm going to send this video to them so that they can show it around the world to their audience, because I think that will be extremely illuminating for them, and it should be helpful. And now I'm going to let.
I just wanted to explain the book for a second. This is Sophie Balk. This book is based on frequently asked questions from this book. Are you all familiar with our pediatric environmental health book, 4th edition?
I am, but can you put it a little bit more on the screen so that people can see it?
Yes. So this book is the 4th edition of a book for pediatricians from the American Academy of Pediatrics. For people who don't know, now I'm a primary care pediatrician. I'm a practicing pediatrician, and the American Academy of Pediatrics is an organization of 67,000 of us pediatricians.
Yes,
and,
I remember.
it has various councils and committees, and this is from the Council on Environmental Health. And Ruth and I have been the editor and associate editor. I'm the associate editor, Ruth is editor-in-chief of this book for all 4 editions. And this latest one was put out in 2018. And it's the only handbook for pediatricians about environmental health. And it's about like over 1,000 pages now. When we started, it was more like 300 pages, but it's gotten bigger and bigger as the field has enlarged. So at the end of each chapter, we put frequently asked questions that pediatricians might get from parents. And this book is a compilation of those questions.
Can you raise that book a little bit?
Which one?
The second one.
The one that we showed.
Yeah, this one.
So it's got the frequently asked questions, which pediatricians might get with some background that we added. So anyway, this is the book that has all the background information. If you know, it's available from the American Academy of Pediatrics, and it's really a resource for pediatricians who may not have all the answers to many of the questions that they're getting from parents. Anything you wanted to add about these, Ruth?
No, I think you've done a great job.
Yes, actually, I remember you gave me the first book when you presented it at our conference at the UN, if you remember. That was in the early 2000s.
Right.
But let's move on to Upper so he can ask the questions from our audience. I already saw about half a dozen from our interns and students. Upper, over to you.
Thanks, Dr. Durbach, and thanks so much, Dr. Ruth Etzel, for taking us through that entire presentation, helping us understand how we promote science-based decision-making, especially related to children's health. As Dr. Durbach was saying, we have a bunch of questions which have come in from a majority of our students in Ukraine who are part of Dr. Durbach's foundation. The first one comes from Julia Danieluk. She asks, thanks for the conversation, Dr. Ruth Etzel. Unfortunately, many children are unaware of the impact of bad habits on their future. They neglect their health and life for quote unquote fun. How do you think it is possible to reduce the promotion of alcohol and tobacco? Obviously, school propaganda is generally not enough.
Sophie, I'll let you. Sophie has been working for many, many years on tobacco issues, and would you like to take that one?
Sure. Well, I can speak about what pediatricians can do in our offices. And we know that what we say to children, teenagers, and families sometimes makes a difference. And if we counsel them about not taking up tobacco, that can make a difference. And it's part of our interview, our confidential interview with teenagers. We ask them about tobacco, we ask them about alcohol and other confidential matters. And it's not just tobacco. In the United States, there are fewer people using tobacco, but what we're seeing is an epidemic of electronic devices being used, with electronic cigarettes and Juul. And these are highly, highly addictive with lots of nicotine. And the kids that use Juul and electronic cigarettes are likely to go on to traditional cigarettes. And we are concerned about creating a new generation of smokers because of that. And the other thing we're learning is the kids that use electronic cigarettes and people who use tobacco are more likely to get COVID because both electronic cigarettes and traditional cigarettes hurt your lungs. And also the hand-mouth behavior that you're exhibiting increases your risk as you're putting your hands to your face and perhaps introducing a virus that's on your hand into your body. But just back to the point, I know pediatricians talking to parents, there is evidence to suggest that we can make a difference, talking to kids themselves, evidence to suggest that we can make a difference with regard to prevention.
I'm going to sort of join another question that we have on a similar topic on this. From this research, the preliminary questionnaire, the confidential questionnaire that you do give out to students, from your research and insights from that, have you seen any methods that have come to the forefront rather than just sort of counseling children that this is bad? Is there anything that has particularly worked?
One of the things you can try to convince them of is that big tobacco or the people that make Juul and electronic cigarettes are really, they're not acting in the kids' best interest. They're just trying to win you over to the fact, to the idea that it's cool if you smoke or vape. And they're just not acting in your best interest. They're trying to pull the wool over your eyes. And sometimes that is successful in convincing them. Any thoughts?
And there's another important thing that we know, and that is that we can put pictures of the harm done by tobacco right on the cigarette package. And we know that those pictures, which can be awfully graphic and horrible, can be a way to dissuade teenagers, because normally teenagers aren't thinking about the long-term impact. They're thinking about the fun it will be today. But those pictures bring right to mind the long-term impact, and that has proven to be successful in many countries.
That's excellent. I have another question on the topic of tobacco itself, but this is a little different in terms of the psychological impact. And this is a question by Ksenia Nikolenko, and they ask, why do adults and children really start smoking? Are there psychological reasons like stress or teenage riot that you have seen rise in the past couple of years?
One of the things is advertising is very successful in winning people over to the idea that smoking is cool. With regard to the developmental stage of adolescence, they tend to feel like they're invulnerable, take risks, not realizing the consequences. Teenage brain is not fully developed until actually the early or mid-20s. So they may not have the judgment that older people have. Also, there's a lot of stress right now, and it may drive people to start with these habits.
Yeah, I can imagine, especially on the stress part, right? And this is another question that comes from Lisa Hagnyluk. She asks, is there any other way to calm down? Is there a quick other alternative for smoking? Judging that this very presentation is also going to be put up on YouTube as a recording, and YouTube is a very young website. It attracts a younger crowd. So potential sort of alternatives for any viewers out there?
I always suggest going, do some physical exercise that makes you feel better if you're able. Especially vigorous exercise raises your endorphin levels, makes you feel better. I personally think like doing something for someone else, community service, makes you feel better. And realize that once you're addicted to nicotine, it's very difficult to stop. It's better not to start in the first place. We also, like if you are a smoker, there are medications that you can use to help you quit smoking. There are several medications you can get over the counter in the United States, at least. Some are prescribed by your doctor, nicotine replacement and others, if you are already addicted to nicotine.
Yeah. That's excellent. It's really interesting as well because, in many cultures, smoking and tobacco use is quite culturally coded, and children can begin to pick up these kind of habits as an early form of development. So say, for example, in the Middle East, where they're growing up around parents who are quite sort of, frequent users of shisha and hookah, and that's sort of, a potential other very culturally accepted way of inhaling tobacco. Many people have it indoors in their homes as well. So in terms of that, is there any research to suggest how sort of these environmental factors which are harmful to children's health can be overcome through sort of cultural nuances?
One of the things that plays such an important role, and that Sophie mentioned, is advertising. And, young children are patterning their behavior after those they admire. It might be the mom and dad, it might be older children in the family, but they also pattern their behavior after advertising that they see online. And we know that the tobacco industry has taken great pains to put advertising in places where 7 to 10-year-olds will see it and think that taking up nicotine or nicotine products is going to make them more popular or more adult or more grown up. And so if we crack down on advertising, as some countries have done, we go a long way towards dispelling these notions that smoking is glamorous and adult, because that really comes from the world of advertising.
Yeah, this actually answers a question I had from Natasha, who really has said that, smoking amongst children and adolescents has existed for a really long time. And, potentially with the help of media and promoting the harmful effects of cigarettes, this can be brought down, which you just answered. I want to take the discussion back to your first slide, Dr. Ruth Etzel, where you spoke about the difference in spending that there is between curative healthcare solutions and preventative healthcare solutions. And we can see in preventative solutions, it's a very small margin, it's just about 4% of spending. What do you think in terms of conflicts of interest, in advocating for preventative solutions when we have an entire pharmaceutical industry and government taxation dependent heavily on just sort of curative solutions? They want people to get sick so that they can buy drugs rather than attack the problem at the root and not get sick in the first place.
That's a very astute observation. And, I have to say that even in medical training, a lot of students don't recognize those conflicts of interest. I have to say, I went through 4 years of medical school not realizing that the drug companies were pushing their drugs on us every single day. And we heard just a fraction of that about prevention. And so it takes a certain amount of wisdom for a young person to start recognizing that they're being sold a bill of goods. And that bill of goods is that disease is caused by germs, bacteria, and viruses, and antibiotics are the cure. We can come out of a medical school training not even recognizing that there's a whole arena of non-pharmaceutical cures for disease, because the emphasis during training of nurses and doctors, at least in the United States, is primarily done through the eyes of the pharmaceutical companies.
Well, Ruth, remember, I was the chair of Physicians Weekly, and you have no idea how much money the pharmas are sending to each doctor, gifts, trips, everything, in order for them to remember them and not to forget to talk about them. And the professors are the same recipients. So it's understandable. I have talked about that for the last 30 years. I didn't make much of a dent.
I think it's a different, at least in my experience here with pediatricians, with pediatrics, we are all about prevention. And a key example of that is immunizations, that we are just devoted to immunizing children from vaccine preventable diseases. That is one of the most important things that we do in our offices and in our advocacy. I think prevention of all sorts of things, we know that what happens early in your life can affect your whole life trajectory. For example, lead poisoning. You get lead poison early in your life, it can affect your whole life trajectory. And there are so many examples of that. And pediatricians tend to be aware of that.
What about the problem of what the woman does while she's pregnant, and to what extent we have severe problems with the children? And I'm not going to go into it because because the mother took drugs in order to make herself feel better instead of going through the pregnancy.
Or a common exposure also would be,
yes.
although it is smoking. And that has effects on low birth weight. It has effects on the baby coming out and having attention deficit hyperactivity disorder, conduct disorder, other behavioral issues. And that's preventable. But that's an example.
What about alcohol?
Exactly, right. Alcohol can be devastating.
Right. Can you be so kind and list some of the problems that mothers and children should be aware of when they take alcohol, besides the alcohol syndrome, which they use an example of what happened with Chernobyl, which has nothing to do, as you know, the alcohol syndrome has nothing to do with nuclear radiation, but that's what they use to add and make movies.
Yeah, alcohol can be devastating to the child, to the developing fetus. Mental retardation, microcephaly, facial abnormalities, a whole array. that again affect your whole life trajectory.
Dr. Etzel, another topic that, that sort of jumped out to me throughout your presentation was the issue of transparency. Now, of course, you are talking about sort of tobacco. Your focus has been on children's environment with exposure to tobacco. And tobacco is something that the general public is aware that it is dangerous for their children and for them, and it's a negative of public health. But what about things that they wouldn't be aware of, like lead in paint, for example, or lead in gasoline in a country where they are living? To what extent, are governments even prepared to be transparent about some of these things? Because of course, the public can read books like yourselves and other authors who've written them, but it is the first and foremost duty of governments to be more cognizant of public health and environmental influences. Do you find that to be the case with any government around the world, even if it's not the United States?
Oh, that's a tough question. What we know is that unless they are forced to put labels on products, industry will do their best to not tell us what is in their products, whether it be paint or gasoline or children's toys. For example, many children's toys that we import from many countries still use lead paint for the paint on the children's toys. Well, we know how many times a toy goes into a child's mouth, and the chance of getting some of those paint chips or paint dust from the toy into the child's bloodstream are quite great. So what we know is that unless forced, industry does not like to tell us what is in their products. They claim that they are proprietary and that they are secret. And it takes a great deal of public pressure on the government to get industry to tell us what is actually in the products that we breathe and that we eat and that we touch.
Yeah. And so then how do we sort of enhance this democratic process to take place by the people, by parents, by teenagers, alongside government? How can we sort of, infuse this public decision-making in governmental processes in a way that is actually beneficial to public health?
Well, one of the most important things is to show that there's a gap. When I tell parents that the government is not taking care of these things, they're shocked. They say, oh, it's government's responsibility. Why aren't they taking care of these things? But in fact, we know that the safety net has holes in it. And there are many, many laws that may be on the books, but not be enforced. Or perhaps some countries don't even have any laws on the books. And so one of the first things that we need to do is to let parents know that these things aren't being taken care of. And once they realize that they're not being taken care of, they can raise their voices much more effectively.
Well, that is a wonderful point for us to end this session. And as I remember telling you, I think that you should have 2 of the webinars so that you can further expand on your issues and have a broader audience. We will do whatever we can. And as I said to you, I will send it to Olga Speranskaya, who's doing a lot with IPEN, and to be able to distribute it to their network. They're working on the persistent organic pollutions. And it is just so important because, we are raising many, many children and all over the world. And many of them are going to be suffering from the consequences of lack of knowledge and lack of information. And hopefully we'll be able to change that a little bit. So thank you, Ruth, and thank you, Sophie. We are very, very grateful. And as I said, we hope to see you again soon. Apurv, over to you.
Thank you very much. Another question that we're getting, Dr. Ruth Etzel, is how do we get access to your book? How can audiences joining this webinar? Is it available on Amazon?
It is. It's on Amazon. It's also available directly through the American Academy of Pediatrics, and I will send you the web link.
Okay, that would be excellent.
We will send
Thank
it
you.
to the link. Thank you.
Thank you for your leadership, Dr. Durbach.
Oh,
you.
thank you for your work and dedication.
Bye.
Same thing with you.
Thank you,
Bye-bye.
everyone who've joined us for another session of World Information Transfer's Virtual Voices series. We thank Dr. Ruth Etzel and Dr. Sophie Balk for joining us to talk about this very, very important issue. And I hope everyone, even though from wherever you are joining around the world, are going to take these lessons back to your home, back to your countries, to the people you interact with, so that we can genuinely mobilize an effort around this. Thank you very much once again.